Check one, two. Check one, two. Check one. What is this? Yes, yes, yes. Listen, we got ready to get started here. Magnificent guests coming on. Dr. Liz O'Ridian. We're going to get this going right now. Dr. Liz O'Ridian. Dr. Liz O'Ridian. Listen, 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 man. We're going to talk about it, be about it. Let's go. All right. Check, check, check. Here we go. Dr. Liz O'Ridian. Let's bring her in. O'Ridian.
Hi.
Hi, how are you?
Good, thanks.
My goodness. I love the curls. Are
Thank you.
those natural or what?
Yeah, they're natural.
I love it. Yeah, I love that. Well, thank you so much for joining us here.
You're welcome.
What time is it over there in the UK?
5 o'clock in the afternoon.
Okay, I love that. Under the Knife. I see your books over there. Is that
Yeah. I've got the other one. Maybe that's the one I should have in, probably.
there you go. Breast cancer. It's the complete. Is
The
that
Complete Guide to Breast Cancer.
okay? Is that one of your books as well?
Yeah.
You, such the author.
Yeah, it's good fun.
Yeah. Well, thank you so much for joining us here at All Talk Oncology. Appreciate it. We had a meet and greet, didn't we, before?
Yeah, we did. Yes.
And you were getting ready to go on vacation or something was going on that we weren't able
Yeah,
to.
that's right. Took us a while to get a meeting, but we're here now.
Here we are. Here we are. I'm excited for this. You know, let's before we get going, just want to kind of get an idea of what is it that you want to highlight during the podcast so that
Hmm.
that way our listeners can really benefit from that. So is there something that you're working on? Is there some things you want to highlight?
So, my next book is coming out in January, which is basically debunking all the myths and misinformation out there about cancer, what doesn't cause it, what doesn't treat it. I get a lot of people sending me reels from TikTok saying, "Is this true?" So, I'm spending a lot of time focusing on that. Um, but I think it's also talking about being honest about the realities of living with cancer as a long-term disease, the side effects, physical, mental. We all need help with all of those.
Yeah, for sure. The realities, right?
Yeah.
Yeah, for sure. Well, let's get it going. How do you pronounce your last name?
Oh, Reardon.
O'Riordan.
Yeah, perfect.
Okay. Dr. Liz O'Ridian.
Yeah.
Okay. I don't want to butcher it.
No, you're fine. Oh, I think like rear as in rear and then done. Oh, rear done.
O'Riordan. Okay.
Perfect.
Riordan. Love it, love it. Well, we're gonna make sure that we we provide a space for you to do that.
Yeah,
And thank you. Let's get this thing going. I'm excited.
great.
Okay. So tell me, you're a breast surgeon. You've been doing this how many years?
I was a breast surgeon for 2 years, and then I got breast cancer, and I that was in 2015, and I retired in 2019 when I had my first recurrence.
Okay, good. And you lived in the UK. What part of UK do you live in?
In Suffolk.
In where?
Suffolk.
Suffolk?
Suffolk. Yeah. Or East Anglia is another way of describing it.
East Anglia?
East Anglia. It's about 2 hours away from London.
East Anglia.
East Anglia. I can put it in the chat. Hold on. Let me put it in the chat to say where I
Yeah,
am.
because
I live
I want to,
in
I
Suffolk
need to,
or
and
near Cambridge. Your
Suffolk.
listeners might know why they might have heard of Cambridge, Cambridge University, so that might be
Sure.
easier for them.
Suffolk. Okay, good deal. All your life in the UK?
Yes, in the UK, yes.
Okay, Suffolk. All right, let's do it. You ready?
Yeah, I'm ready. Let's go. Let's keep the energy up.
Hello, hello, hello. This is Kenny Perkins, aka your cancer guy. And today we have another phenomenal guest. We're flying all the way to the UK, right? I mean, we're bringing you this person from the UK. I'm here in the US, but she's in the UK. And let me tell you, this next guest, she's a breast surgeon. She's a person who has worked with people who have had breast cancer, needed reductions, or needed to remove that. She's been involved in that. She knows what you're going through, right? And not only does she know what you're going through because of her profession, she's also been a person who's been diagnosed with breast cancer. So she understands completely inside and out. And so for us, it's an honor to have this next guest on our show. It's an honor for her to bring in a professional perspective, right? In addition to some of the questions that people have about what do you go through when you're having breast cancer, some of the misconceptions, as you know, here as cancer for a cancer coach, we go through all of that and we help you with that. But you know what? Bringing a professional who understands it is going to help you. And so let's enlighten you. Let's make sure that as you go on your journey, then you have the full spectrum, right? And that's what it's about, bringing in these resources that can help you along this journey to let you know you're not alone in this. We're in this together. Our next guest, as I said, we're going to the UK. And listen, she is from a town what we call, she says Suffolk, right? And please forgive me because I will butcher things up in here. You guys know me, but she's from Suffolk. If you guys know where Cambridge is at, she's near there. Our next guest is Liz Oridian. Please bring her to the show.
Hi,
Liz.
Kenny. Hi, it's great to be with you today.
Listen, Liz, thank you so much for joining us on All Talk Oncology. It's a privilege and an honor to have you on our show today.
Oh, thank you. I'm glad to be here.
Yes. Now, if for those that are looking on our YouTube channel, then you can see that, Liz, she has that curly hair, is spunky. She's got the glasses. She's let me tell you, she's a stylist, you know. But for those that are listening in, let me tell you, she has a warm smile, and it's a privilege that I can bring her here on the show today. And so, Liz, tell us a little bit about your background and how you landed in this profession.
So I always wanted to be a surgeon ever since I was a little girl. My dad was a surgeon, my mum was a nurse. I was fascinated by the human body. And I did some work experience when I was 17 where I got to see surgeons operating, and I just knew this was what I wanted to do all the way through medical school. And my problem was I loved every surgical specialty. I loved bowel surgery. I loved blood vessel surgery. I loved it all. And then a wise man once told me that you pick the body fluid you mind the least. And with breast surgery, there isn't any body fluid, maybe the odd sweaty armpit, but there's no on call. My husband is a surgeon and he'll spend weeks and weekends working 24-hour shifts. And I don't like that. So with breast surgery, there are no emergencies. And I loved it for two reasons. One, you develop a really long lasting relationship with your patients. And two, it is so creative. Every breast is different. And to be able to reshape and remold and hide the scars and reconstruct breasts, it's just incredible. And I just love the speciality. But it's hard because there are days where you feel like you are just being paid to make women cry. I could tell 10 women every Friday that they've got breast cancer or it's come back or they need chemotherapy. And that's really, really hard to deal with.
Yeah. I can imagine. I can imagine, Iridian, that emotional roller coaster that you have to go through
Yeah.
every
And you
single
don't get training. You don't get training to deal with the stress of telling men and women they've got cancer. It's just part of the job and it can really eat away at you.
yeah. You know what that also says, Dr. Iridian, is that it's the human side of us. No matter
Yeah.
what profession we do, we're a surgeon, we're a doctor, we're therapists, we're whatever. It shows the human side of it. And, I'm glad you can express that. You know, for someone to have helped, I mean, the thousands of breast patients that you've dealt with,
Hmm.
you know, what was that like on the other end to find out that you were diagnosed with breast cancer?
Oh, it was tough. I mean, I'm not a normal patient. I was diagnosed in 2015 the first time when I was 40. I never checked my breasts because I didn't think it would happen to me. I was fit, healthy, triathlete. I barely drank at the time. And I just got out the shower and noticed a lump in my left cleavage. And I just thought it was a breast cyst. I'd had a normal mammogram 9 months before. And I didn't find out in the normal way. Most of the time, when you have a cancer diagnosis, it comes in stages. You see a doctor, you have a test, you have a biopsy, you get the results, you have surgery, you get the results, you are drip fed information. My mammogram was normal because I had very dense breasts, but I had an ultrasound and I looked at the screen because I did ultrasounds myself as a surgeon and I saw the cancer. Before they drew up the local anesthetic for the biopsy, my surgeon who trained me came in and said, "Where do you want to be treated?" I knew what my risk of recurrence in 10 years was. I knew I need chemotherapy. And it was suddenly, there was so much information in my head that I did not need to know at that moment in time. And because I have all this information about what the future might hold, my mum and dad, my husband didn't need to know that. And a large part of me was in denial, and I think still is, to protect me because I've looked after women younger than me who had died. And it's very hard as a doctor looking after patients who are doctors, assuming what we know and what we don't know. And it was really, really tough going through every treatment that my own patients had and actually finding out for myself just how bad or how hard it could be.
It's interesting, Dr. Iridian, what you just talked about. Here we are, we're like the superheroes, right, in our profession,
Yeah.
right? And people look to us, and we are so used to helping everyone else. We never think it's going to happen to us.
Hmm.
For you to go through that and seeing that feeling of that feeling, well, just describe a little bit, sitting in that, what do you remember?
It's funny. I would break bad news 10, 20 times a week. And I thought I was good at it. And it's a privilege to do it well. But we know anecdotally, patients only remember a fraction of what we say. And I knew what I was going to be told. I knew it was cancer. And my boss was crying, my husband was crying. And it's like I'm floating, looking down on this happening. And my surgeon is telling me you'll need chemotherapy. And it's like, this isn't really happening. And it's only when I saw the oncologist, because I had chemotherapy first, and you're like, oh, damn, this is real. She's telling me that I'm going to be infertile, so I can never have children, and I'm going to lose my hair, and all the potential side effects, complications, the risk of death from chemo. And it's like, this is really real. This is what it is like to be on the other side of the table, saying yes to a whole list of things you don't want. And that fear of how long have I got left? How bad is it going to be? What happens if it comes back? It flips your life completely upside down. And I went from being a in control surgeon to a frightened, vulnerable, scared patient. And it was really humbling. And it changed everything I knew about what breast cancer was, because when you go through it, it is suddenly so real.
Yes. Understanding those feelings now from sitting on the other side,
Mm.
you know, us as professionals, what would you say that's missing from the professional side that we can bring over
Yeah.
on the other side? What would you say?
Oh, a lot of it are things that are never going to happen. Time. I was only given 10 minutes for my every consultation because you don't know how many cancers you're going to get. You're always running late. And I think as a surgeon, I was so focused rightly on giving a good result, treating women to the best available trials and evidence, doing the right thing for them. But the third part of quality care is the patient experience. And I realized I had no idea as a surgeon what my breast care nurses told the patients when I left the room. Were they telling them all the other bits I didn't have time for? Well, no, they're mopping up my tears and going over what I've said. And I think, especially in this digital age, I used to tell patients, don't Google. It's crap. Sorry to swear. It's the first thing I did. I went on my phone. And I think what we need to be doing is realizing that the tiny fraction of breast cancer treatment is actually what we do in hospital. The huge bit is what happens when we say goodbye, see you in a year, and you are left to live with the impact of a diagnosis. And patients want to know what to eat, what to drink, how to exercise, what's safe, what can they do to stop it coming back, how to cope with the side effects of the crash menopause and tamoxifen, the mental health, the anxiety, the fear of recurrence. And I think we don't, as surgeons, as doctors, you don't have time to go through all of that. Patients aren't ready to hear it. But I think we should be all digitally signposting patients to sensible places of information in the US, breastcancer.org, in the UK, Breast Cancer UK, saying, you're going to go on your phone. There's a lot of misinformation out there, but these are safe places you can go to that you can send your friends and family to. Because rather than me being diagnosed, explaining to my mum what chemo is like, and I'm trying to remember what you told me, Kenny, I can say, Mum, go here, and you can read it for yourself. And ask your patients at that 1 year follow up, what books, websites, apps did you find helpful? And you can then create a list to say, you're going to go on your phone, start here. And this will tell you how to cope with the side effects, the fear of recurrence. Many women don't know it can come back. And I think that's where we're missing a huge trick.
Yes. I hope you guys heard those gems. I hope you listened to Dr. Iridian. She's dropping them for because us as professionals, a lot of time we're good at what we do.
Yeah.
We are amazing, but it's the things I always say when you're at home, laying in bed, and you're wondering, is this thing gonna come back?
Yeah.
Am I going to get through this? Am I going to die? Am I going to be
Yeah.
able to see my family and graduate and go on vacations? Those are the things that we handle as cancer coaching. But those are the things that in our profession, when you're getting treatment, you're getting chemo, you don't get that. And
I
so,
think patients don't want to ask you. They don't want to waste your time. They know how busy you are. And I'll be honest, Kenny, as a surgeon, I had never gone on a breast cancer forum or looked at what people were saying online because I was too busy trying to learn the best way to treat them. I didn't know what questions patients were asking when they left my room. And I'm embarrassed to say that, but actually, I think it's really important. And people are now actually hearing what it is like from patients. There are so many women who don't realize their breast cancer can come back in 20 years. They think they're treated. They don't know what the signs of recurrence are. But as a doctor, when do you tell someone that their cancer can come back? It's like, great, it's all clear. The surgery went really well. But by the way, it can come back in 20 years. That feels wrong. If you wait a year to do it, it might be too late because of early recurrences. And I think it's finding a way to help people along that path, giving them the right information when they need it, but knowing where to go.
yes. So as you went through your process and getting
Mm.
the chemo, getting and talk to us, what type of treatments did you receive?
So I had, I'll go from the beginning. My ultrasound showed a 2.5 centimeter cancer, and it was mixed ductal and lobular, ER positive, HER2 negative. I had an MRI because the mammogram was normal, and that showed that cancer was close to 6 centimeters. So I had chemo up front to try and shrink it down, and I had docetaxel, and then I had FEC, 3 rounds of each. And the MRI showed that the tumor had completely disappeared, a complete radiological response. But I still had a mastectomy because I had small breasts. And the results of my mastectomy, this is when I really got a shock. Um, My two of my sentinel nodes were positive, and there was 13 centimeters of lobular cancer left in my breast. Completely occult. The ductal had disappeared, but 13 centimeters of cancer left. And again, as a surgeon, I know what that means. So I had an axillary clearance, and then I had radiotherapy to the chest wall and to my supraclavicular area, and I was put on tamoxifen and Zoladex. And that was tough. The instant crash menopause, the pain of the Zoladex injections. I had post mastectomy pain syndrome. The implant that I had an implant mastectomy, nipple sparing reconstruction. The radiotherapy made that become painful and tight. I had a frozen shoulder. My arm was really sore. It was really, 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 really hard. 2.5 years later, I'd had a nodule of scar tissue in my armpit that I'd been having physio on, and my implant was so painful. I had a grade 4 capsule. I decided to go flat. But my surgeon said, let's just scan that nodule of scar tissue. And that was a 2.5 centimeter local recurrence, local regional recurrence. And I know what it means for it to come back so early. So my implant was removed. I had a second complete round of radiotherapy to my armpit. My ovaries were removed, and I was put on an aromatase inhibitor. But last year in 2023, I woke up one morning, actually the day before my memoir Under the Knife was launched. I noticed a little red spot above my mastectomy scar. And that was a second local recurrence, again, lobular, again, ER positive, HER2 negative. So I had that removed, and I am now on bum injections, Faslodex, and palbociclib for life, or until my cancer comes back.
Mm.
And I'm now struggling with the collateral damage of those treatments, the hit of the menopause, the fatigue, the tongue ulcers, the neutropenia. It's really, really hard. And I think as a surgeon, everything we do in oncology is based on trials. It's all based, this trial showed this trial showed that, we have the data. There are no trials for people who've had one or two local recurrences because there are so few of us. It's oncologists treating us with the best of their information, their experience. And it's really hard to find other women who've gone through what I've gone through, to know if what I'm thinking is normal. There isn't a tribe of people to find. And I think that can be quite a lonely place. The same if you have a rare cancer.
Yes. You know, I listened to you, and you took me through the journey, and you fast tracked it through the journey. But, it's one thing to get the mindset to go through the first treatment, right?
Yeah.
Okay, this is happening to me. I'm on the other side now. I'm going through this treatment. And you're like, okay, got it. But then it's like, damn, right? And it's really good. You could say that. It's like, damn, like
Yeah.
another
Yeah.
one's come. Like,
I know.
what the heck is going on?
And I found chemo so hard. I found it hard to ask for help. A surgeon in me, I like to control everything. I don't like admitting I'm vulnerable. And I would wait till my husband had gone to work, and I would cry, sat down in the shower because I didn't have the energy to stand up. I felt so low. And I was a fit triathlete. How do I put my 60-year-old people through this? I didn't recognize myself when I looked in the mirror. I'd lost all my hair. Radiotherapy was hard. Exercise helped, but I'd lost my job. I couldn't operate. I'd lost my identity. I still get sad every time I see a child walking down the street because I knew I could never be a mother. The grief of the loss of everything cancer takes from you is really, really hard. And I swear it took me 5 years to not wake up every day thinking, is this the day it comes back? And every time you get a cough or a headache, you think, is this a headache or is this my breast cancer coming back? And I can't bother my oncologist every time I have a symptom, but that fear is real because we know people can be diagnosed de novo from the beginning with metastatic breast cancer and have no symptoms. And what I know as a surgeon doesn't compete with what I feel as a patient. And it's really, really hard. And I think now people say, well, what's the point in having chemo if it didn't work? Well, I know it gave me the best chance. If I hadn't have had chemo, then I might not be here now. But I now realize, and this took time, we all die. And you can find out you've got a 95% chance of making it, but you don't know if you're in that 95% chance who will or the 5 who won't. And I think for me, we're all going to die. And it's 50-50 whether it's my breast cancer or not, actually, because I die of a heart attack or breast cancer. It's 50-50. And I can do everything I can to reduce the risk of it being breast cancer by eating a healthy diet and cutting back on alcohol and exercising regularly. But outside of that, it's out of my control. And that's helped me stop worrying so much and just try and live my life. But then someone in the media gets breast cancer or a friend dies, and that guilt comes back.
You say guilt. Describe that.
Survivor's guilt. So the problem is when you have breast cancer and you talk about it online, you get friends who have breast cancer. And the guilt I feel when they get a recurrence and they die and I don't. I wish I had it. I feel guilty that I'm alive and they're not. And it was the same. My mum was diagnosed with osteosarcoma. She had her arm amputated and died 5 months later. And I felt guilty. I thought I was meant to die first. It's not fair. Nothing about cancer is rational or logical, but that guilt you feel when you're alive and they're not, you just think it's not fair. Why me? I want to put myself in my place, although you don't want to be in their place. And a friend of mine who had melanoma, who came back, said he was actually pleased when it came back because it meant he could stop waiting for it to happen and he could start dealing with it. And I didn't get how a good news, a clear scan can be a huge anticlimax because Kenny, you've worked yourself up to think, okay, it's Mets, I can deal with this. And when it's not, you think, well, that's great, but damn, I'm going to have to go through this again in the future because I know I'm going to have another scare and my body can't take it. Nobody wants to have a recurrence, but like I get what he thought. Every time I have a scan, it's like I almost want it to be positive because I cannot cope with this anxiety. I don't want to have to go through this again.
Skin anxiety is a real thing.
I had no idea. And again, in MDTs, if your results come over Christmas or Easter or the holidays, that appointment is pushed back by 2 weeks. But you were at home waiting with the phone in your hand, imagining the worst. It's not fair.
How, Dr. Iridian, how do you get the resilience, and you're dealing with something like this? You've
Mhm.
had the reoccurrence. The worst things in your mind are actually happening. And then you're saying,
Yeah.
okay, somehow I need to stay positive in some way because I need to live my life. But at the same time, how do I live my life when things like this continue to happen? I want to be resilient, but at the same time, it's difficult. How do you deal with that?
Oh, I wish I knew. I I was not this person before I was diagnosed. Cancer has given me strength and resilience that I never knew I had because I don't think you have a choice. You just have to go through life. This happens to you. You have to deal with it. And I live in chronic pain every day, but I can't whinge about that all the while. People get fed up. Having a tribe of people you can talk to whinge and moan and rant to people who get it can help. So you know it's normal. You can share their experiences. That has been a huge help. I've got a group of doctors with cancer on WhatsApp, and that's been a great way of just de-stressing. I've had therapy, psychological counseling, and that's been great to talk to someone and I don't have to worry how they are when I leave the room. Because if you tell your partner how you feel, then you're living with their coping with that. So therapy was brilliant at just helping me rationally come to terms with what has happened, find ways to cope when I'm having a bad day. I've learned to tell my husband that I'm having an irrational wobble. Don't tell me it'll be fine. Just be patient with me because I will come out of this. Because everyone wants to say you'll be fine and they can't promise you will be. Exercise helps. While I'm exercising, I'm just Liz. I'm not a cancer patient. I love being out in nature, walking the dog, looking at the birds, trying to find those little things that remind me I'm me. But it's really, really hard. And I think a lot of the time I pretend it hasn't happened. Writing helped, journaling and getting everything down on paper so I can put distance from it. But you just find a way. The bins still need putting out, the dishwasher still needs emptying. There are birthdays and things to plan for. Um, it is just a roller coaster. And I think accepting this is your life now, and there can be huge moments of joy and happiness. I am happier and stronger now. I mean, if you told me 40, 20, if you told me 10 years ago that in 10 years' time I would be speaking all over the world, I would have 3 books coming out, I would have a podcast, I'd win awards for what I'm doing, I'd be one of the global oncology influencers to follow, I'd have said that's nonsense. That woman's never going to do that. She'd never have the balls to do that. But cancer opens as many doors as it closes if you look for them. And the thing that keeps me going, I lost my career, my identity, my financial status, but I found a new way to help people because deep down, that's what I am. And if just one person listens to my podcast, so now I've got breast cancer and says, hey, thanks for talking about getting your sex life back. I listened to the episode with my husband and we're dating again. It's that brings me joy.
I love that. I love that, doctor. And you you're an amazing individual to bring that vulnerability so other people can benefit from it,
Yeah.
right? Because
I,
on the other side of fear is where the blessing is at. And
yeah.
you're giving people the blessing by your experience. So thank
I
you.
think it started. My husband said I should start a blog. I didn't even know what a blog was back in 2015. I saw a few, and a lot of them were quite rightly, they're exaggerated. Poison slash burn. People tend to tell the bad. They don't tell the normal or the mediocre. And it can be really scary as a patient reading a cancer blog that chemotherapy is poisoning you and radiotherapy is burning you. And I just wanted to say in quite calm, simple terms, this is what it's like and this is what's happening, and trying not be sensationalist. And I think I discovered by sharing what it was like, I could help other people. And that led to me, my husband's very accepting, talking about the problems about how it impacts your sex life and the mental health, and just by being real. And I could only do that because I was no longer a doctor. I knew that patients wouldn't be influenced by what I was saying or want to see me. I was almost free to speak openly about what it was like. And I've got the mental bandwidth to kind of dissociate what I'm sharing online with what I'm really feeling. So I can be open and honest and knowing it's okay. And I think if someone else knows it's normal to feel like this, they can then go and ask for help.
Yes, 1000%. And it's those topics that you just mentioned. Sometimes you're talking about being intimate with your partner
Yeah.
the feeling that you want to be intimate, but at the same time, you don't feel maybe you don't feel as beautiful as you are because guess what? You have a mastectomy. How many people feel that? But
Yeah. And I think it's sorry, you lose your hair, your eyelashes, eyebrows, your body image changes. You can put on weight because of the drugs. You've got scars. You have no sex hormones. How do you get your partner to understand that you still find them attractive, but you no longer physically get turned on because of cancer treatment? There's so much that has to be dealt with. And I never got it as a surgeon. I'd give people a leaflet saying, get your body image back, but it's only when you've been through it. I didn't look at myself naked for 5 months when I had my implant removed because I hated my ugly scar. How can you let someone say you're attractive when you don't find yourself attractive? And I think we really need to consider how every serious illness we treat as a doctor impacts someone's intimate life. I spoke to a head and neck nurse who herself had tongue cancer, and she said it took her 5 years to learn the only place she could kiss her husband was in the shower, where she could use the water of the shower to lubricate the mouth, because putting in fake saliva before you kissed your husband just isn't doing it for her. And no one had ever thought, why would you want to kiss? You've had like tongue cancer. That's disgusting. But she said, well, no, it's not. I know a woman with bowel cancer who asked her surgeon, what does she do with her colostomy on a one night stand? And he looked horrified because he couldn't imagine having a stoma and wanting to have sex. But to her, it's like, come on. And I think as doctors, we have preconceived ideas about what is and isn't possible after a cancer diagnosis. And luckily, there are amazing patients out there changing our thoughts and beliefs.
listen, if you're listening to this, if you're listening to this podcast, Dr. Iridian is dropping gems. Okay. This is stuff that needs to be spoken about. These are things that sometimes you don't feel comfortable. So as you heard her say, some physicians don't know how to speak about it. But today you're getting lessons. So I hope you're taking notes today. This woman, this human being in front of me is a phenomenal person.
Oh,
And thank you so much for this. And I want to tell you, I want to ask you this, because you didn't have to keep going. I,
no.
I want to pause with this, right? You didn't have to continue. You didn't have to go back to treatments. You didn't have to continue fighting. What is it that made you say, I'm going to continue on? Because your continuance has has been a blessing to others. But I want to know what allowed you to say, I'm going to continue.
And by continue, do you mean all the advocacy work and the writing that I'm doing now, or did you mean going back to work before my cancer came back?
I mean, continuing to fight, even though you have these reoccurrences, and
Okay.
you have this cancer, that you didn't
Yeah.
give up. What made you going to continue and not give up? Because a lot of people give up, as you know.
So this may be controversial. I hate the fighting, war, battling analogy. And I know it's more common in the States, but to me, a soldier chooses to go into battle and to fight.
Mm.
No one chooses to have cancer. It happens to us. And when we die, it's not because we lost our battle or we didn't fight hard enough. It's because medical science lost the battle. And if anyone says I lost the fight, I will come back and haunt them because it's don't. You live every day, and I don't like the fighting because there are people out there with far worse things who are fighting to live. I think you're just living and you are finding a way to cope with the physical and mental side effects and you do the best you can. And some days you may do 1%, but that's 100% on your bad day. I don't think people ever really give up. I think they may not get the help they need to cope, but you only really give up when the drugs stop working. Um, it's really interesting because you can talk to anyone with cancer and they will all have a different mental belief structure to keep them going. There are some people who are fighting, especially those with stage 4. They are fighting the side effects. They are fighting for more research. They are fighting to get every month that they can to stay alive, but they're not fighting the cancer. Does that make sense? And I think for me, there are days when I wish I could give up doing what I'm doing now, the books and the podcasts and the talking and the videos, but it's that keeps my brain going. It keeps me stimulated. It gives me a job. It gives me a purpose. It's exhausting. I don't get paid for any of it. And the days when I just want to just stop, the days I almost want my cancer to come back so I can clear the diary and just be me. But I'd be bored and I'd end up going back to it. And I think cancer gives you a new awareness as to what is important in life. And whilst handbags and shoes are nice, it's the memories, it's the time you spend with people. It gives you a new balance on what's important. But I don't think I'm fighting. I'm just alive. And I am coping with what life has thrown at me. It could be far worse, it could be far easier, but that's what fate dealt me.
Well said. Well said, Liz. Thank you so much for that. And I love teaching us different ways to how we speak about it. And that needs
Yeah.
to happen 100%.
It's not a fight because fighting sounds, glamorous and sexy and we're going to do this, but actually it's out of our control. Cancer is a sneaky sword. It can mutate. You can't beat bad biology. This is not a fight. We only know we've won the fight if we die of something else. And the women with breast cancer who don't die of a recurrence don't make the headlines. We only hear about the people who lose, where medical science lost the fight. And I think we need to start saying we are curing more and more women. Chemotherapy is a great drug. Doctors are doing amazing work. We are keeping people more alive for longer, but you can't prove that until they die of something else. And I'd love to try and change the narrative and make the positive, the resources, the new techniques coming, get them out there. That was very rambling, but you know what I mean, Kenny. Science is incredible. There are vaccines around the corner. We should be singing from the rooftops of how great we are at treating cancer.
Yes. We've come a long way.
We have. It's incredible. There's now personalized I know what mutation my cancer has. If it comes back, there's a drug targeting that specific mutation that will work for me. This is amazing. So this will blow your mind. 20 years ago, I was doing a PhD looking into molecular oncology, looking at cyclin dependent kinases, CDK4 and 6. I am now taking a CDK4 and 6 inhibitor. That's
Wow.
amazing.
Wow. Imagine that. I think it's full circle.
Yeah, completely.
Wow. Dr. Iridian, for those that are listening in, what would you like to say to them? What
Oh,
gem? gem would you like to deliver to them?
I would like to say two things. Firstly, and most importantly, you're not alone. You may feel you're alone. I didn't see another person in the flesh having treatment. I found people online. But there are people out there going through what you're going through who understand, who you can talk to, who will help you get through this. I think that is really, really important. Find your tribe and they will help. The second thing, on a completely different, less emotional tack, is there is so much misinformation out there online. It's hard to know who to trust. There are 10,000 cancer diet books on Amazon. I never tell patients what to eat because they just assumed it's a normal, healthy diet. But people are searching, and cancer makes you vulnerable and desperate for certainty and hope and a cure. And that is the one thing your doctors cannot promise you. No one can tell you 100% that you will be cured. But there are people online practicing different forms of medicine, selling different forms of supplements and cures who promise you that and are making a lot of money off you. And I would say, do not get your medical information from an internet, the book, a podcast, an article, even what I'm saying. If you see something online and you want to try it, please, please, please check with your team first to see if it's true. Because the power of a testimonial, my aunt in a Facebook group said that she cured herself drinking soursop juice, is making women turn down chemo to go and do that. And that's what really, really scares me. I get it. We're desperate, we're vulnerable, but please don't get your medical information from the internet. Check everything with your team first, because if it worked, we would give it to you as part of your treatment.
I love that. And speaking on that note, Dr. Ridian, you have created something for people specifically for these misconceptions, right?
Yeah, I have.
Talk to us a little bit about what you put together.
Thank you, Kenny. So I never realized what people wanted to know until I had a cancer patient, until I had cancer myself, and people ask me questions I think are quite simple. But then I'm a cancer surgeon. Like, what actually causes cancer? And is it true that deodorants cause breast cancer? Or will the keto diet really cure me? Is keto better than chemo? And I spend a lot of time doing videos to debunk this. But what I've done is created a book, which is out on January the 30th, called The Cancer Roadmap, just to tell anybody with cancer what actually it is. And um, I use the word chocolate to describe how cancer forms. It's really simple. What causes it and what doesn't, and why we treat it and what doesn't work, and breaking down all those myths that you hear and helping you understand what good science is and how to spot the red flags and what the dangers are. Because I just want to help as much people as possible understand the reality of cancer so they're not wasting their time and money on things that aren't going to work. Because even now, off the back of the Elle Macpherson debacle, there are women in Australia refusing chemotherapy because she turned it down. And that really worries me.
Yes. Thank you so much for that. You know, and we need that. We need that in this industry. We need to know that some of these misconceptions are exactly that. They're
Yeah.
misconceptions.
And it's like with a podcast. So you and I both know that we are experts in our field, but there are podcasts where you interview someone and you don't check what that person is saying. You assume it's right because you think they're an expert, and then they say something based on a mouse study 20 years ago, and that 60-second clip goes viral. So podcasts are the latest place people are getting their misinformation from. And it's because we're just all desperate for hope and a cure. They are preying on us. We are so vulnerable, and it's really hard to accept that no one can give you that. And it's the boring stuff that does work, like eating a healthy diet and exercising. It's not sexy. It's hard work. I'd rather swallow a pill and have a drip. And I get that completely. But I think we need more education and more to tell people this is something you can control. This is something you can do to reduce your risk of it coming back.
Yes. My goodness. We see it
Yeah,
all, don't we?
we do.
Yeah, we do. Well, let me ask you this final question here. The life now, okay?
Hmm.
The life that Dr. Iridian had before, how is it different now in your perspective on how you're doing things compared to who you were before the diagnosis?
Oh, so before the diagnosis, I defined myself as a breast cancer surgeon. I worked long days. I'd had suicidal depression twice, just through the stress of telling women they had cancer. My husband was a surgeon. We both worked very hard, and I had very few hobbies, very few friends, because you move around the country a lot. I was quite insular and isolated and an introvert. And I was happy with my relatively lonely life, I think. And having had cancer made me question everything. I had to come to terms with the loss of everything I knew. I wasn't a breast surgeon anymore. What do I call myself? What have I wasted 20 years of my life doing? My mum's died of cancer. My dad's died. My cancer's come back twice. It's been an awful lot of crap that's happened in my life. But I now know that I need to be a bit selfish. That if you don't look after yourself, no one else will. And I need to take that time to say, I just need a day for me. I need an hour for me. I think that's been really important because as a doctor, I'm a yes person. I help everybody and I'm at the bottom of the pile after my husband and the dog. And it's actually no, I need to look after myself. So I am well enough to cope with whatever happens. I have made more friends. I am seeing people. I'm going on more holidays. I've started wild swimming in December. I'm doing stuff. I'm trying new things because life is precious. Life is short. You don't know how long you have. I say yes to almost everything that comes that way. I've stood on a stage in front of 1,000 people to talk about my life. It's made me braver to try new things because what's the worst that can happen? It doesn't work. You don't like it. You've tried. And I am happier and stronger and more fulfilled. And I'm almost glad is never the word, but cancer has been a gift in some way because I've had an extra 20 years of almost retiring early and being forced to find out who I am. And it's been lovely. But yes, it's shit. There are bad days, days I cry. You can't complain about that. You learn to accept the bad in life. But I found a new way to appreciate what's really important.
I love that. I love that. Such a different perspective. And you glow. You glow as you talked about it.
And it's funny, I think so many people are in jobs they don't like, in situations they don't like, and they're too scared to step away and make a change. And all too often, it's when something massive, traumatic happens in your life. There's a crisis where you actually have to resign. And I wish people had the strength and courage to act on that gut feeling before it gets to that stage.
You heard it here. Dr. Iridian's giving you gems. He's dropping knowledge today. Dr. Iridian, it's a privilege, such a privilege to have you on this show. I hope that we can continue to help individuals out here, enlighten,
You,
bring advocacy, right? I hope that we can continue that. And you are a phenomenal human being. Your courage, your strength has empowered me just to continue making sure that I continue to do the things and follow my purpose. So thank you so much.
oh, thank you. You are doing great things with this podcast. I think just by talking about cancer, making it seem normal, making people understand, it's huge. So thank you for what you do.
Thank you. As we say to everyone, you're not alone in this.
No.
We're in this together. This is Kenny Perkins, AKA your cancer guy. And until again, we're out. Thank you so much.
Oh, that was brilliant. Thank you, Kenny.
Oh my goodness, you are phenomenal, and you know, getting out. As I say, for me, I would love to be the Oprah of cancer. That's my goal, right? I mean,
Yep.
we are international, global. We've talked to people from around the world, the UK, Canada, India, Greece. But let's do that, right? Let's
Yeah.
bring about change in that area, and doing conferences and things like that where people can really benefit. You know,
Yeah.
and as you know, being the breast surgeon, we're in our profession and we do what we do best, right? I'm a board certified radiation therapist. So
Yeah.
to do what we do our jobs well. But this is the other aspect of it.
Yeah.
And there's a small minority of people doing it. So for us to stick together, it's phenomenal. I just did an interview with someone from Sloan Kettering. She was there for
Hmm.
25 years, and she also spoke on this. So being the resource to bring us together. I think
Yeah,
we have
it's
something.
incredible.
It's going to be
I think
amazing.
it's realizing cancer doesn't stop when patients leave your office, and we
Yes,
need to help them live because it's becoming a chronic disease. So, yeah, thank you for everything you do.
for sure. Before we
You're
let you go,
welcome.
though, I would like to
Yeah,
say this. What was it about All Talk Oncology that made you decide to come on?
I've listened to a couple of the shows and I think it's a great podcast. I think the American interviews are very different to what happens over here. For me, it's getting, I get partly getting my voice known in another audience, but just speaking to you who gets it as a cancer doctor, realizing that you don't know everything and you're willing to learn and to share that expert knowledge to me it's great what you're doing.
Thank you. And for those that never heard of All Talk Oncology, what would you tell them about us?
I say go and give it a listen. Education is power, and being empowered is the only way to get through this.
Thank you so much, Dr. Riddick. I appreciate you so much. And I would love to make sure I get a link so I can refer
Yeah,
people to that book
I
that
will
comes
send you
out.
a link to the book. I'll do that tomorrow. So you know how to link into everything I do. But thank you for letting me mentioning it.
Yes, 100%. And if you ever travel to the US, make sure you look me up.
I will do. Whereabouts in the US are you based?
California, uh,
Okay.
like Los Angeles area.
Yeah, I will let. I think I'm going to Chicago in May, but I will let you know.
Yes.
But take care and enjoy the rest of your day, Kenny.
Thank you, Dr. Riddick. Take care.
Bye.